adopted.
Maker of the motion.
Thank you, Madam Speaker. I do have a couple of questions for the floor leader, if I may.
Floor leader.
Thank you, Madam
morning.
Speaker. Good morning.
So this bill, House Bill 413, Health Insurance, Individual Market Stabilization, Extension of Provider Fees. It appears to me that this bill is a tax on people's health insurance. Is that correct?
It is a tax on the health insurance carriers, which, as I said to you yesterday, they have the discretion of passing along to the consumer, as does every business. Yes.
So this bill calls for a tax on the health insurance carriers who obviously are going to pass the tax on to the people who buy health insurance from the health insurance carriers. Isn't that so?
They have the discretion to do that. Oh.
And how much is the tax?
In a
Chair
way,
of the committee.
Thank you, Madam Speaker. In a way, to clarify this with the information that makes the administration bill more clear, this fee may be passed on to the consumer. But remember, insurance is dense. There is a lot of complication. These policies can only be allowed, the carriers can only be allowed to have so much money that they keep above what they pay out, or what is called the loss ratio for the insurance. So if it turns out that they can't keep the money as profit anyway, that they would rebate it back to the person who is not necessarily the policy holder, but the contract holder with them, then it might not be returned. So some of it, it would be returned. So if it's over the amount that they can keep as profit, they can't keep it, which means they would likely use it from that pot of money and not charge the consumer that extra fee. You have to remember that though you see the front end of this, you don't see all of the pieces at the back end. With that, I'll turn it back over to the floor leader, and I apologize, but I'm tired of hearing this try to be a bill that it's not intended to be. This bill is intended to continue to help people be able to afford insurance.
Floor leader.
Madam Speaker, thank you. And I would add, in addition to the chair's comments, that while this 1%, first of all, this 1% began as 2.75% 3 years ago. It is now 1%, and this 1% of that is potentially passed along under certain circumstances is 1% compared to the money that the premiums have been reduced by 32% over the last 3 years because of the existence of the reinsurance program. So I think there's a pretty good return on investment of that 1%.
So that was a lot of percentages for a question, and that was a simple question. This bill, House Bill 413, is a tax on the health insurance companies who are then passing that tax on to the people that are buying health insurance from those companies.
I think they say on Law and Order, asked and answered.
Okay. So I think that's a yes. So the next question is, how much money has been collected so far, approximately, with the tax on the citizens who are buying health insurance and the health insurance companies?
Okay, so in 2019, when this tax began, this premium tax began, it was 326 million. And what was needed for reinsurance that year was 353 million. So that money went back to the care of individuals. In 2020, it was 118 million because we went down to 1%. And in 2021, it was 124 million. And that is what the state contributes in order to collect the federal pass-through funds. And it's the federal pass-through funds which have really allowed this fund to grow to the point that we've needed over the last 3 years and project to need in the future.
And how many companies are in the individual market?
There are 3 companies in the individual market.
There are 3. I thought there were only 2. Blue Cross and,
United
Kaiser.
joined us in 2020.
okay. And how much market share does Blue Cross Blue Shield have?
I can't give you that percent, but it is the largest percent.
So they've got like, they're like 90% of the market. So this tax actually is, it could actually push the other smaller companies out of the market, potentially.
Actually, what it did, the effect of having the reinsurance program brought United into the market. So it had the inverse effect.
And I just want to just clarify one last thing, and that is prior to Obamacare, we had 7 companies in the individual market.
That's my understanding, yes.
Okay. And now we have, you said 3,
3.
but looks like 2. Thank you. I appreciate
Okay.
you answering my
Thank you.
questions. Madam Speaker, I do have an amendment at the desk. It's amendment number 703523/1.
Amendment number 1.
Move so much be considered the reading of the amendment, Madam Speaker.
So ordered.
Ladies and gentlemen, this is a very simple amendment. All it does is say that we want to and should be studying the effectiveness of this program, including whether patients in the program are getting healthier. And we should do that before we impose a tax on people's health care insurance. Makes perfect sense, especially on a bill that's not sunsetting. I mean, it was our understanding that the bill was going to sunset and then there would be a study, and the study would be necessary because the market has indeed stabilized, which it has. But instead, for whatever reason, we have House Bill 413, which is going to continue to tax your health care insurance in the individual market, making it even more difficult to, of course, purchase health insurance because it's being taxed. So it's an extension of a tax without even studying whether the tax is A, still necessary, and B, whether or not stabilization is something that is going to be sustainable. And so, Madam Speaker, for all those reasons, I move this very common sense amendment. We should be studying these things very carefully after having put them in effect just a few years ago before we tax people even more, especially now. Thank you, Madam Speaker.
Madam Speaker.
Yes. Floor leader, I'm sorry.
Thank you, Madam Speaker. Thank you, sir. I wish I could see the amendment. I can't. It's not on the floor system, but I think I know the content in general. First of all, there is a sunset on this bill. It is a 5-year waiver, so it goes to 2028. There is nothing in this bill that precludes us from studying the information around outcomes, and in fact, there was a great deal of discussion in my subcommittee about doing that. And I would point the body to the fact that there is a study in the bill. On page 3 of the bill, section 2, there's a study that says in the report of the MIA, they'll consider whether the level of funding is appropriate, consider whether the assessment established under the insurance article is appropriately apportioned among the carriers, should be broadened, should be supplemented with general funds, consider what market reforms are necessary, continuation of the program, providing state-provided premium subsidies, expanding eligibility, evaluate the design of the program, whether the program parameters established in the insurance articles are appropriate, including the Young Adult Subsidies Program, the Easy Enrollment Health Insurance Program, special other enrollment periods, premium subsidies available under the American Rescue Act, etc. There is already a study. I would ask the body to resist the amendment.
Madam Speaker.
The maker of the amendment.
Thank you, Madam Speaker. I just want to make a very important clarification, and that is that there was the understanding that there would be a study during the period of time when the tax first went into place in 2019. And so what the committee decided to do with this particular bill, House Bill 413, is to instead study it after they tax it. You know, we got to tax it before we study it. And that's what this bill does. It's absurd. It's an absurd insult to the citizens of the state who are tired of rising prices across the board. And this does one more thing. It increases taxes yet again on the citizens of the state. And so for all those reasons, Madam Speaker, I move the amendment. Thank you.
Chair of the committee.
Thank you, Madam Speaker. It is unfortunate that the study was not done, and the gentleman is accurate that there should have been a study done, and we won't argue that he's wrong. That said, we believe the study will be done this time, and I'm very confident that going forward, the Health and Government Operations Committee will make sure that they see that study, because we do need the study, you're correct, but we have the study in the bill, and for that reason, I will support the governor's bill, and I would like to have you all oppose this amendment. Thank you.
The question before the House is the adoption of the administration's amendment. All in favor signify by saying aye. Oppose?
Roll call, Madam Speaker.
Roll call.
Madam Speaker,
Clerk will take the call. The amendment fails.